Hi everybody, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we are going to talk about the A, B, and C's of Medicare. We can even call it the ABCDs of Medicare if you want. And we're talking about this today because I have experienced personally a lot of confusion when it comes to all the different ways that patients can have Medicare insurance, and trying to explain it to your front desk staff, your billing staff, anybody responsible for registering the patient and billing the patient. Medicare is available to anybody who is 65 or older, and it is also oftentimes available to people who are on some kind of disability medical-wise. So if they have end-stage renal disease, or they have ALS, or if they have been deemed disabled in a very long process they have to go through, then they qualify earlier than turning 65. Some things to know about Medicare is there are so many different moving parts that patients can choose from when they become eligible for Medicare that you have to kind of know what I'm going to teach you today in order to understand how the patient should be registered with their insurance, asking the patient the correct questions because they don't even understand fully, and then making sure that you're sending out clean claims to the proper insurances. Let's jump in. So Medicare Part A is given to anybody and everybody who's on Medicare, and it's covered basically by your Medicare benefits when you turn 65 or become eligible because of disability. Now, Part A only covers hospital stays, hospital services. Anything done where you are in the hospital gets billed to Medicare Part A. Everybody has Medicare Part A, no matter if they choose the next few options or how they choose the next few options, I should say, that I'm going to discuss. Medicare Part B, as in boy, is going to be the physician or professional services, if you will. Medicare Part B is what insurance will be billed if a patient comes in and says, this is the only coverage I have, and they present you with their red, white, and blue card, and it has Part A on it, Part B, and it will have the effective dates for each one. And you'll say, do you have a supplemental? No. Do you have any other coverage? No. And then you enter it. If a patient says, well, I also have Medicaid, if they're over age 65, then Medicaid is always going to be secondary to their Medicare insurance. Medicare will always be billed first, and if anything is left over, it will automatically get sent over to their Medicaid plan by their Medicare plan if Medicare is aware they have a Medicaid plan. And usually when you're checking benefits, there should be some notation somewhere in the Medicare eligibility checks that indicates that there's other coverage. And if that's the case, you'd want to check either a supplemental or Medicaid. Now, Medicare Part C, as in cat, is also called Medicare Advantage plans. Basically, it's people who want to pay a little bit extra than what they would be paying monthly for the straight Medicare Part B plan. And it's actually a little bit more organized and runs more like a commercial plan than through a Medicare plan. It's still considered a Medicare plan, but you're going to be billing and sending claims to whatever insurance company is managing or facilitating that Advantage plan. Those cards will say Medicare Advantage Plan or Medicare Plan. It will indicate somewhere on there on the card itself that it's a Medicare associated plan. Usually it will have a Medicare RX symbol indicating for the pharmacies when the patient goes to the pharmacy, all the numbers the pharmacy would need for that plan to bill their drugs. So this kind of incorporates all of the beneficiaries' coverage into one. The Part B is replaced by a Part C plan, and it also incorporates a Part D plan, which is the drugs. It's kind of like a one-stop shop, if you will, and it helps people kind of keep everything in one place and understand that all their bills and everything will be coming from one entity. If a patient chooses just to have a Medicare Part B plan and nothing else, then they have to choose a Medicare Part D, as in drug, plan as well. The Medicare Part D plan is for prescription coverage because Medicare Part B, as in boy, only covers office visits and outside the hospital visits and services. So if they want prescription coverage because they're on meds, not only do they need a Medicare Part B as in boy plan, but they also need to sign up for a Medicare Part D as in drug plan. That's why a lot of people elect to just have a Medicare Part C plan that encompasses all of the things that you would need to kind of a la carte choose separately. If someone wanted to pay a little bit more, but not maybe as much as an Advantage plan, or they don't feel they need as much coverage as an Advantage plan, if someone chose just to keep their Medicare Part B and to choose a Medicare Part D plan, but they just want to be a little bit more safe with coverage and maybe not spend as much, they can choose supplement plan, and some of the supplements can be an F plan, a G plan, and these plans are Medicare supplemental plans, and the cards will say Medicare supplemental. The nice thing about the supplement plans is you don't have to individually contract and credential with those plans. If you're participating with straight Medicare, then you automatically are participating with the supplement plans, which is great. And you need to make sure that you're entering Medicare Part B as in boy as their primary insurance and their supplement plan as their secondary insurance. Also, the nice thing is Medicare will automatically forward anything to their supplement plan, so you don't have to worry about that either. The supplement plans can get a little confusing, but like I said, you guys have to read the insurance cards and it will tell you what to do. If they have an Advantage plan, which could be a PPO plan or an HMO plan, then you would want to make sure that is their only insurance billed. You wouldn't also enter their Medicare Part B because they are replacing that coverage with the C plan. This is where I see a lot of confusion because people think that they still have to bill Medicare Part B and the Advantage plan, and that's not the case. I do still encourage you and your staff to be scanning in that Medicare card just for documentation purposes in case you need their Medicare number in the future, but the Part C plans will give them their own ID number for that specific insurance, and you wouldn't need to use the Medicare number for billing purposes. You might need it in the future to look them up in a system, or if they change insurances and don't notify you, you could use that to try to find what their new insurance is, but you would only bill the ID number and group number that is provided by the Advantage plan. Now, Medicare beneficiaries can change their plans every year, so they have to make their election by a certain time in November, and that will go into effect the following January 1. That's why it's really important that your staff make sure they're asking Medicare beneficiaries every first of the year or first time they're seen within a year about their insurance to make sure it hasn't changed at all. This is really confusing. I encourage you to let your staff watch this and then maybe even put down a cheat sheet saying the different options that patients could have, so they could have a Part B plan only, and that would be their primary and only insurance you bill. They could have a Part B and a supplement plan, or they also call the supplement plans a Medigap plan. So you could put that in there. So Medicare Part B would be their primary and Part supplemental would be their secondary. They can have just an Advantage plan that replaces all of that, and that would be their primary insurance, or they could be a Medi-Medi, which is what we call beneficiaries that have both Medicare and Medicaid, and if they're over the age of 65, no matter what, Medicare will be billed first, Medicaid will be secondary. If they happen to have Medicare Part B, a supplemental, and Medicaid, then they would have 3 insurances to bill. So you would put Medicare Part B as primary, their supplemental as secondary, and their Medicaid would be tertiary. I don't know how much your EHR or your billing system or billing team is willing to bill out. Sometimes they'll only go as far as secondary insurances, but others will go up to tertiary. So it's definitely something you'd want to find out about. It's not super common, but it does happen. And then there's all these other situations that you can get into with TRICARE beneficiaries with Medicare and people who are still working or their spouses are still working and covering them on, and those are a whole different story, but the most common ones are going to be the Medicare Part B, the Medicare Part B with supplemental, or the Medicare Part C. The Medicare Part D won't really affect you unless you bill out for medications, and in that case you would want their Medicare Part D information, but if you don't and you just prescribe medication to a pharmacy, you don't need their Part D information, so that's kind of nice. You wouldn't have to worry about that. The questions that your staff should be asking is, do you have an Advantage plan? That's a ring word. They would know Advantage plan. Yeah, I have an Advantage. Or supplement. Oh yeah, this is my supplement. So if a patient only hands your front desk a Medicare Part B card, one of the big things they should ask is, are we only billing Medicare, or do you also have a supplement plan? Or do you have an Advantage plan? And if they go, oh yeah, I have an Advantage plan too, even though it's confusing to them, your staff should understand, oh, this replaces the Medicare Part B, and I'm only going to enter the Advantage plan information, but I will scan in both cards just for future reference and documentation. I hope this helps. If you have any questions or concerns, please leave that in the comments below. Smash that thumbs up button if today's video was helpful. Please share my video with anybody who you feel it would benefit and help understand their role in your practice. And subscribe to my channel if you haven't already. I appreciate the support. Have a wonderful day. Take care of yourselves. Bye-bye.